Ever wonder how to implement all that you've learned in one of our classes with your clients? Listen into today's episode on how physical therapist and IBH certified birth healing specialist and owner of the Healing Spot, Justine Calderwood, is using what she learned from the holistic treatment of the Postpartum Body course as she walks us through her treatment of a postpartum client suffering from incontinence and back pain. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to this episode where I am so excited to introduce you to Justine Calderwood. Justine is a physical therapist in the Colorado Springs, Colorado area. She owns her practice, Healing Spot Physical Therapy. Welcome to the podcast, Justine. Thanks for being here.
Hi, Lynn. Thanks for inviting me. It's a pleasure to be here. I always enjoy talking to you.
Me too. Me too. So I was so excited when you said yes to doing this because Justine is actually one of my early on students. I think you took one of my earliest courses in learning the pregnancy, postpartum, and then the advanced work as well, right? Like, wasn't it 2018 or 17? What do you remember what?
I can't remember. When did you start teaching? And I was your first class that went through the certification. I want to say end of 2018, but it
I think
could
so
have
too. I think
been
it was
2017.
2018.
Okay.
Yeah. You took it
Yeah.
when I taught it, like I had pregnancy 1 month, postpartum the next month, and then the advanced the following month. And that was really kind of fun because there was a group of you that all went through that together. And yeah, so that was really
Yeah,
cool.
it was pretty neat. Yeah,
Yes.
I still keep in touch with some of those students from that first certification kind of round that you
Yeah.
did.
Yeah.
Yeah.
That was so cool. So tell me, how has this work, understanding what you learned in those courses, how has that impacted your practice?
It's impacted it in a big way in the sense that prior to taking your classes, I was doing some pelvic floor work. I admit I was pretty new to it, probably within the first year of doing pelvic floor work. I ended up taking your classes. And at this point, heavily seeing more pregnant and postpartum clients. Throughout different stages of being postpartum, some older ladies that it's been a while since they've had their kiddos, but I would say most of my practice is the younger mamas that are coming in with first time babies, or maybe, sixth or seventh pregnancy. I'm seeing those moms as well.
Yes.
But a lot of postpartum moms. And it's really changed my practice, quite honestly. I'm so passionate about treating the pregnant postpartum moms. And
Yeah.
it's helped me in other ways too. I mean, I do see still people that come in, maybe they're not a mom, or they're not coming in necessarily for just pelvic floor issues, but it's few and far between with those people that are coming in with, hey, I have back pain, can you help me? That's kind of more, I feel like, more straightforward in a way than the pelvic floor issues combined with it. So
Yeah. Well, so I asked Justine to share a couple of case studies with us today. So I thought it would be interesting to see, for us to discuss some of your cases that you've experienced. So do you want to start
yeah.
by sharing one of them?
Yeah, I got a patient right now that I'm seeing, and our last visit was so exciting to me. I want to tell you just a little bit of background on her. So I started seeing her in June, so June 2023. We are now in August. So she's 29-year-old female, and she came in more with she's postpartum, and let's see, 3 months postpartum, and she was having urinary incontinence. She's got some allergies. We were in allergy season. So she said, Justine, anytime that I cough in particular, I'm leaking. It's getting very annoying. She's young, and she wants to be out of this. The other thing with her is she's actually going through a divorce. And so, like what she didn't say was, hey, this is a period of change in her life. She's actually still living with her ex, or soon to be ex, in the same house. So it's been a bit of a navigation for her to figure out this kind of relationship. supporting her daughter, and also like what's moving forward, right?
And
And so what was not spoken was kind of like this change in relationship and how this might impact her in the future.
right. So she just
So
has the one baby that's 3 months old, correct?
yes, yep.
Okay. All right.
Um, no, actually, so yeah, she was 4 months old. Sorry,
Okay.
so close.
Yeah.
Very young, very
Yes.
young little
Yes.
little baby. Yeah. So she came in, and I checked her basically, just like I do, just checking for mobility, alignment, posture, diastasis, looking at mobility throughout her sacrum and that pelvic ring. And what I found with her is that she was, had a lot of these postpartum like open birth patterns that you teach about. So I got to work with like checking in. I always like to like check the nervous system and help
Yeah.
deregulate that, or like help calm it down. So we worked some on that, and then also the mobility external. That's where I start.
And so I want to comment on that because I think that
Mhm.
is just so critical. The nervous system. It just reminded me of a patient that I saw yesterday, and new mom within the first year. I would say any mom that we're working with within that first year could really use some nervous system support. Right. And
Mhm.
whether it's
Yeah.
just we help them to figure out how to breathe, to turn on that parasympathetic nervous system. But Justine, you have two girls and I have two
Mhm.
boys. And I don't know about you, but I noticed a huge uptick in my nervous system that first year of
Yes.
their life, right? Like that first time mom, that first year, I remember at 13 months going like all of a sudden my nervous system just went, phew, and like settled. And I hadn't
Mhm.
realized how much my nervous system was activated for that whole year. And so I think all of us listening in here know how to help calm down those nervous system for our postpartum mamas, especially first time mamas, first year. It's stressful. And
It is stressful, yeah, and they're sleep deprived, and they're trying to
yes,
figure out, how do I return to work? She's a working mom as well. So how do I return to work? And she's a very highly educated lady. And how do I manage that? And then, like I said, she's going through this big change in her relationship.
uh,
And so, I can only imagine what that does to the nervous system as well. So
right.
yeah,
Yeah.
the breath work and getting the hands on and giving her some tools to actually help her. Oh, the other thing I didn't mention is she had some back pain as well, when
Okay.
she first came in. So that
Yeah.
was a big driving force of things with her. In addition to the urinary incontinence, she was like, "I'm in pain here, and I've been stretching," and she went over the things that she's doing. I had to kind of slow her down in a way of like,
Yeah.
"Okay, take some breaths while you're actually stretching and be with your body, be present. Let's figure out what's going on here."
Right. Well, and don't you find that a lot of our postpartum clients are disconnected from their body, especially their pelvic
Mhm.
space after having a
Yeah,
baby, and
yeah,
an intense experience that
yeah.
people are not connected there. So,
Yeah, even the most beautiful births, they'll say,
yeah,
"Oh, I had a great birth," and nothing sticks out. It's very rare that we don't find something, that they were worried about, or that maybe didn't go as planned, or something that maybe just needs to resolve. And sometimes people are even more surprised they find more than they ever thought.
yeah,
So,
yeah. All right. Well, you're
yeah.
definitely describing our very, very common postpartum patient, right? Back pain, stress
Yes.
incontinence.
Yep.
See
Yep.
that a lot.
So
Yeah.
she was very tight in her psoas, particularly on the right side. So, those are some of the things that I did with her, release her psoas, because as we know, that kind of is tied into that stress response and then the nervous system. So they're going to be in that fight or flight mode. And that can be activated from lifestyle things, posture, from, again, this relationship change that she's going through. It can be from any birth trauma, whatever. Pregnancy itself, it changes the posture, positioning,
Yeah.
and tone. And so we started on that, and I was able to modify some of what she was doing at home to really make it more effective, trying to use her time, her very limited time, to take care of
Right.
herself at home. What's the most important things to do? That's part of my job, teaching here, okay, slow down. Let's use this little ball to release this myofascially in addition to what I could do for her. Really trying to not to let my patients be overly dependent on what I can do with my hands or the guidance I can do in the clinic. I think it's really important, again, that empowerment and helping them to be present in their body, in their pelvic space, because that's where they can get their own answers to a lot of things.
Yeah. And
So,
I also just want to put in there that as therapists, we need to be careful of how much we give our clients to do. You know,
yeah.
they don't have time for 15-20 minute exercise programs, you know. It's like
No.
I really try to encourage the activity throughout the day as being
Mm,
their exercise, you know, so
yeah.
that
Absolutely,
they
because
aren't
if you give them too much, they get
they're not
shame they feel shameful and guilty when they come in. I don't want they already have that. They already have that in their
right.
baggage.
Yeah.
They don't need that from me. So, yeah,
Yeah.
and trying to help them to see, like, if we're doing inner core strengthening, hey, we're on hands and knees. This is where your baby can be, and you can be making little silly faces and doing a few, like, that counts. It doesn't
Yes.
have to be these hour-long sessions that you were used
Yes.
to and had the luxury of having prior to
Right.
baby. Like, let's make
Right.
this work.
Yes. Yes.
Yeah.
Yes. Yes.
So
Yes.
definitely
Yeah.
did that with her.
Great.
Um, One thing I wanted to share was really last time that I saw her, or no, 2 visits ago, we did pelvic assessment, and I found that she wasn't connected. She didn't know how to do a Kegel. So when I was checking for just tone in her pelvic floor muscle, any asymmetries. I checked, of course, bladder and uterus and looking at all the ligaments and all of that stuff that you've taught me. But I came back and I said, okay, I want you to do a Kegel. I want to see what your strength is. And she was bearing down. She didn't know how to do a Kegel properly. And so I gave her some cueing. I was in intravaginally, so I was able to press into the muscles and say, okay, draw my finger in. And I gave her some cueing, and she right away she had a nice strong Kegel, but not as strong as I would have liked, but strong
Okay.
enough. I was like, okay, you're getting this.
Yes.
So I stood her up. No, so I was still in supine with her on her back, and I was checking for prolapse. So I was checking at rest, like bladder position, because I kind of suspected some of the things that she had told me, heaviness, just this, response to pressures, that's when she was having a lot more leaking.
Yeah.
So I checked her, like you've taught me how to use a little balloon to blow up and check that kind of bearing down in a more functional way, and found that she was okay lying down, but when we stood up, definitely a different story. I mean, even at rest, I could just feel that bladder coming down. It was,
So I want
yeah.
to ask you, so in supine, did you feel the sagginess of the bladder in supine that made you think prolapse or not?
At that time, no. I
Right.
mean, I could feel the change with like coughing, but I'm at that point where I'm like, I don't know. Does everybody's bladder kind of move with coughing? I'm finding that
I think it
you
does.
can,
I really, there's a
yeah, to
little
some
bit.
degree.
To some
Yeah.
degree there is, but it's the
Yeah.
degree. And I do
Yeah.
find, I just worked with someone yesterday whose urethra, it wasn't the bladder, the urethra
Oh,
moved, not like it was
yeah.
bladder tissue did not, but boy, that urethra sure did kind of
Hmm.
bulge, bear down. So yeah,
Yeah.
but I just want to kind of reiterate that when I have been surprised too when I check someone supine and I have zero sense. Like there are some people whose bladders, when they're in supine, the bladder is just saggy and it's mushy. It's
Hmm.
just like, oh, this is a prolapse, right? But there have
Yeah.
been people who you feel their bladder in supine and you're like, they're good. They're good.
Hmm.
But you stand them up and it's down.
Yeah.
So
Yeah. It's like
that
just
what you
right there.
sense with this with
That's
this
what I found.
yeah, yeah,
Yep.
that's
That's what I found with her.
that's
Hold on.
why I think it is imperative for all of us, anybody listening in, if you do intravaginal work, we must, if we suspect prolapse, assess in standing. We have to assess in standing because we can be fooled, just like we were talking
Hmm.
about with this client here, that, she
Yeah.
feels good. Yeah, there's a little bit coming down, but okay, that could be normal. I just did a post on social media talking about normal, and I put normal in quotes because
we sense that it's normal, but actually what's been happening to me lately is I'm like, oh, that's a normal distance of those ischial tuberosities, but yet my intuition calls me to stay there. And then when I
Hmm.
stay there, and then I'm like, oh, wait a minute. No, they're coming in. They're more, it's more narrow. Like, so what I thought was normal, well, actually wasn't their normal. And I also
Yeah.
felt that on the anal sphincter. I think it was an anal sphincter muscle that I was working on. I'm like, oh, this is all normal, but my thumb wouldn't move from it. And then as it released more, I'm like, oh, that's normal. So
Uh-huh.
I
Yeah.
I want everyone to kind of question this idea of what they consider normal. Is it really normal for that person? So,
Yeah. Yeah, there are times I agree with that. Well, I think it's, oh, or I'm not sure. Okay, is this moving well? Okay, I'm just gonna nudge it. Like the PSISs, for instance, I've had a patient where I was like, this feels like it's moving okay, but I was just like, I'm gonna just nudge this and bring them close together. And then pretty soon they were softening, and she said, wow, I'm feeling a lot of release in my abdomen right now. I would have never predicted that, right?
right.
And so sometimes I just nudge things that I'm led to, and if it's going to move, if it needs to move, it will. And
Right.
when we respect the tissues, which is your number one, rule, when you respect the
Yes.
tissues, you're not forcing anything. If it needs to go there, it will. If it doesn't, it'll stay, and you just move on to the next thing.
I love that
Yeah.
word nudge. I don't use that, but yeah, that is, I say encourage, right? You're like, let's just encourage, let's
Okay.
like that. But it is like you're, like you said, a little nudge. If I nudge it, what happens? And then you
Right.
stay curious with the tissues, right? So
Yeah. Yeah.
yeah,
It's so fun.
isn't
So,
it?
so fun. Um,
So
okay, so I stood
yeah.
stood her up and checked her in standing, and also checked her Kegel strength in standing. And even though I had just taught her how to engage, she really didn't have much Kegel strength. Like she didn't have much pelvic floor strength in standing. And so um, I was like, okay, just took a note on that. But what I did in that session is a technique you've taught on how to mobilize the bladder and bring it back up, kind of on the little pubic shelf.
No,
And so I
yeah,
did that. Yeah, I just felt that, felt it move. And to be honest, that technique, I don't know. Sometimes it works and sometimes it doesn't, right? It just
yep,
depends on what
I
else is
agree.
going on. So I
Yep.
was like, all right, I'm going to nudge this. I'm going to see, it seemed to move. Great. So we left it at that. And I told her, oh no, another thing I checked her for was actually how well could she do a Kegel prior to coughing to just give a little support. So
Yep.
I checked that, and it wasn't great, but I said, you know what? Now you know how to do a Kegel. I want you to practice that. That's your homework over the next week. Anytime you got a cough, sneeze, anything like that, I just want you to bring awareness to your pelvic floor, contract it first if you can prior to, having that sudden increase in pressure. So she came back a week later and she said, I feel so much better. She goes, I feel like I'm able to contract my pelvic floor. She goes, I'm having less leaking. And she's like, I feel better. I don't know if that's true. Maybe I'm just making that up. And I said, okay, well, let's check.
Yeah.
So we checked. And I tell you, when I got her standing again and checked, her bladder was in a much better place. Like it wasn't as saggy, it wasn't down as far. And
Yeah.
her Kegel strength, they said, okay, do a Kegel. It was strong. I'm like, you have this. It worked. So seeing the objective findings that, things had changed that I could sense and I could tell,
Yeah.
and her symptoms changed. Now we don't always get that
Right.
sudden change in 1 week. Um, Sometimes we do, obviously, but it's
Yeah.
so fun.
Yeah, it is, isn't it? I love it. So do you know if she tore at all? Did she?
That's a good question. I don't know on that, honestly.
Okay. Because what I just wanted to kind of talk a little bit about that bladder, like so in standing, and what's common. I don't know if you found it more on her left side, but I always find that the left side of the bladder does get more saggy or more pulled down. Although
Hmm.
just yesterday I was working with someone, it was on the right side. So you treat what you find. But I would
Yeah.
say it's, in the thousands of women I've worked with, it's more on the left than it is the right. But getting that tissue back up onto the shelf, the pubic shelf, we're talking in standing here, It
Mhm.
really, if there was tearing, if there was a tear in that perineal area, that could be kind of pulling that bladder tissue down on that side. And that's why I was asking that question to see, because we really need to release that scar tissue back up. But even if there's not that scar tissue pulling the bladder down, just the act of that baby coming through kind of tugs that
Mhm.
bladder down as it's coming through, and getting that bladder back into place instantaneously changes the pelvic floor muscle strength. It's
Mhm.
it's amazing.
Yeah,
And
I
so
do find that.
I think
Yeah.
that's what you experienced there with her. And that's so cool. Oh my gosh.
Yeah.
I
Well, and
love
we did some, we did other things too. Like we did pelvic
it.
floor release work, and whether
Yep.
that was from a tear or, fascial restrictions, what have you, I treat what I find basically. If it's tight, I'm gonna give it a little nudge, see if it's ready to release,
Yeah.
and
Yeah. Yeah.
uh
I love that
those
term. I'm going to
things.
start using that, Justine. Nudge it.
Yeah, do it.
I mean, really think about that baby's head coming through that vaginal canal and all that fascia that is being, and the baby twists so that the head
Hmm.
has to turn in order for it to come through. And so think of all the tugging on that fascial system in that vaginal area. So that
Yeah.
alone needs our attention, needs some, and I have to say, I haven't been experiencing this lately, but I did early on. And sometimes I think things pop up for my learning, but I was actually able to feel at some point the twisting of the, either in the muscles or in that vaginal space. I could feel which direction the baby's head turned, as
Hmm.
that twist was still kind of in the tissues there. And so gotta remember that and help that
Yeah.
tissue find its happy home as that baby, has now come through, it's out, but the effect of that is still being held in the fascia, in the muscles, in the organs of this entire
Yeah.
area. And we have to address it all. We can't just focus on muscles, everybody.
Yeah, exactly. That's interesting. I just had a light bulb moment. I have felt that twist in the pelvic floor muscles around the coccyx, all of that. But I don't think in my mind consciously I ever put it with that could have been baby's movement. I just follow again and just nudge the tissue and follow. It's got its own story, its own,
Yes.
mobility thing that it wants to do. And I give control to the patient's body to show me what it needs and
Yes.
lead me into it. I'm just there nudging, honestly.
Yeah. I
So
love
that's interesting. I love that thought of like that was actually
the
baby
direction the
possibly
baby
moving.
turned as it came on out. Yeah. Yeah, yeah,
Mhm.
yeah. And that's where I love that you said that, because the body tells us what it went through when we learn to listen to it.
Yeah.
So it's just having that ability. And that's what you had taken a bunch of myofascial release courses before you came and took my courses. So you
Yeah.
had that background so
Yeah.
that my
Oh,
idea.
they blend so well together. Yeah, they absolutely blend very well together.
And so
Yeah.
that, it is just about letting the tissues show you what they need. And all we do is just follow it. It's again, working with the body is like hide and seek. I say this all the time, but it's like,
Mhm.
that twist that you experienced in there, once you like identify it and you call it out, then the body goes, oh, I give up. Okay, I let go. Don't you find that that's
Yes. Yeah, it just softens. Yeah.
I went and had a session with a body worker that I work with, and she's taken all of the Burrell. She just worked with John Pierre for Brain 2 just a couple of weeks ago before I went in. And I was talking to her about it, and I was laying there, she was working on me. I go, do you ever find that if you say what you find out loud, that the body just like gives up? And she goes, yes, I just don't know why I don't do a running dialogue while I'm working on the body. And I go, oh, exactly. That's so effective. Like, oh, this side just won't release, or this one is more splayed, or, that kind of thing. So,
Yeah.
yeah, it is so,
Yeah.
so helpful. Well, anything else you want to tell us about this client? How's she doing now?
Uh, so I've seen that was the last time I saw her where things were improved and she was she was starting to make some improvements with, pelvic floor and her symptoms. So we've taken a couple weeks break because she's going to be moving. So, just like she's taking the lead with that, letting her
Yeah.
decide in a way like, okay, I need a little break so I can take care of my other stressors.
Yeah.
And so she'll be coming back, I think, next week or the week after. So I'll be
Cool.
excited to work with her again and see what else.
Yeah.
I never have a plan when my patients walk in. It's just, I got to check in with them. How are you feeling? If they tell me, gosh, today I have a headache, we go there because that's where her body's calling. And just
Yeah.
again, give the body some nudges and follow its lead. Where do you need me today?
Yeah.
So we'll see. Yeah.
That's so exciting. I do want to share. I also had a client yesterday whose pelvic floor strength was better supine and hands and knees versus standing. And so that's telling us that it just doesn't have the strength to work against
Mhm.
gravity. And so I instructed her, I want you to do all your Kegels in supine or in hands and knees. Let's get you stronger there. And then let's see if we can't get it more into the upright position. So that's, what I will be
Yeah.
working with her next time she comes in, and seeing if
Yeah.
that is different. But I
Yeah.
do, I so appreciate you sharing this case with us. It's so interesting because we've all, I mean, that is probably the most common thing is stress incontinence and low back pain. So,
Yeah.
yeah,
And I will say her back pain is so much better. I mean, I want to say the last time she came in, that wasn't even something that we were really focused in on.
yeah.
She's really made some good change with that. So
Good,
yeah,
good. Well, you didn't talk much about this, but I feel that it is that when we get the bones back into play, like, was this the one that you were talking about nudging the PSISs, or was that just someone else that you were sharing
that
about?
was somebody else. Yeah, yeah,
Okay,
yeah.
okay.
But
So,
I mean, I looked at, because in standing she was very lordotic. She was very much like lengthened out through those abdominal muscles. She felt like she was still in that open birth pattern. So just looking at mobility around the sacrum and the pubic bones and the ilium, the ischiums, and just getting all of that balanced. Yeah.
yeah,
It was part of it. It was part of relieving her back pain, in addition to looking at soft tissue, lower abdominal fascia, and the psoas in particular were very
I
tight
was
with her.
I was curious when you said her right side psoas was tighter. I'm wondering if she was more splayed on that right side ischium. I
Yeah.
haven't made that correlation in my practice to see that, but that psoas attaches to that lesser trochanter. Is that helping to know if that's of the femur? Never mind. Sorry, my mind went somewhere
Yeah.
else. But well, and also her right side being that masculine side and going through a divorce
Mhm.
and dealing with her husband, that
Yeah.
could all be
Well, and it pulls it up. It pulls up that ilium, and
yeah,
like I often see that compressed more in that side where that psoas is tight. And if we can get that lengthened out, what does that do for that whole bottom portion?
yeah,
The pelvis getting more balanced.
yeah,
Yeah.
yeah. Well, balancing the pelvis is key. I think that's the key to what you're sharing here is making
Yeah.
sure those bones are in their proper place and have that good mobility, right? I don't think that's one thing that I never learned in PT school is the bones of the pelvis and how they should move. I mean, we only really focused on that SI joint and if there was a little bit of
Right.
movement in there, right?
Yeah,
But
yeah, and nutation, it was so confusing to me in PT school. I'm like, I don't know what the hell I'm doing with what you just taught me. Have them stand up and flex. I never really got that, honestly, and
I
it was confusing. And kudos to the PTs that
I
works
can
for,
get
and
it.
that
Yeah.
they understood that. That was not for me.
You're talking about the standing stork test where we have
Yes.
on the sacrum and the other on the PSIS. And then you're supposed to have the person lift that leg that your PSIS finger is on. So they march, they lift that knee up in the air. And you're supposed to be able to discern whether there was movement or not movement in the
Mhm.
sacroiliac joint. I am right there with you, Justine. I hate it. I could never feel it. And
Yeah.
especially someone that had any sort of adipose tissue on them, it's
Yes.
just like, oh
Which
my
is
goodness.
most people.
Right, exactly.
Yeah.
So I agree
Yeah.
with you. Kudos to those PTs that can use that as an assessment tool. But oh my goodness, when I learned with Jerry Hush how to spring test the pelvis, that was a game changer for me, a total game changer. And that's what I
Yeah.
teach in my courses. And so I do want to just throw out there that I have created a new course, Treatment of the Postpartum Pelvis, and it is just all about the pelvis. It's only a 3-hour online course packed full of information that I dive into the research a little bit of that standing stork testing and form and force closure, and dive in all of that, but talk about the 4 different patterns I find in the postpartum pelvis and how to correct those. So you learn all the techniques to close up the pelvis after birth, just like Justine was talking here. So for those of you that are interested in just learning about the pelvis, I really encourage you to check that out. We are doing this in a cohort fashion this year. We will be signing up for this. The registration will open the end of September, and the first cohort will start October 2nd. So if you're interested in joining that, I am going to be offering a Zoom call at the end of that cohort to review all the techniques with you to make sure you've got them down. It is my goal, Justine, and you've seen how impactful the closing of the bones is on your practice and your results with your clients. And I just really want to get this work out into the world, into more people's hands. So if you're not interested in the whole holism or the holistic part of, or learning about the whole body, please just come take this Treatment of the Postpartum Pelvis course and know how to affect change in the pelvis after birth. That's the entire reason that I put that course together, is to help more therapists be more effective with working with the pelvis. And what do you want to say about, Justine, those techniques and what you've learned and how they
It helps. Honestly, I remember the very first time I took, I think it was the pregnancy course, but even with that, going back and working with anybody that has a pelvis
men
helped me
do,
to just
right?
understand, the spring tests and the mobility, and how to actually release that. It has been a game changer. Even with at that time I was seeing, male clients for back pain.
Yeah.
So yeah, anybody, it doesn't matter. You do not need to be pregnant or postpartum to be able to apply those techniques to any population. If someone has a pelvis, yes,
Right.
you
So
can
this,
assess it. It's so
yes,
useful.
right. And so even for you, male therapists out there that are, working with the general population, if you're working with women, no matter where they are in their lifespan, if they've had a baby, these techniques will totally help you with them, but it will also help you with men and back pain and issues like that. So I think one of the common birth pattern, the common postpartum pattern that I teach, I think is in everybody. And so learning those techniques and how to shift that can really help your back pain patients. So, yeah,
Absolutely.
awesome.
Yeah.
Thank you, Justine, so much for sharing your case study with you. Good job on those results there. And I want to thank everybody for listening in today. And here is to smoother births and faster recoveries. And we'll see you all on the next episode. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.